Well, Nurses Appreciation Week begins tomorrow. It is a week to say thank you and to honor the nurses who play a vital role in our lives and our healthcare. Joining us now from Good Samaritan Hospital in West Islip is Catholic Health's Chief Nursing Officer, Gara Edelstein. Gara, thanks for joining us.
Good morning. Thank you for having me.
And let me be one of the first to say Happy Nurses Week one day early.
Thank you.
As Chief Nursing Officer, you are overseeing a huge staff of nurses. How many are there at Catholic Health?
So Catholic Health we probably have over 4,000 nurses across the system and growing every day.
Yeah, wow. With 6 hospitals, the different type of nursing specialties that you have at the at Catholic Health?
Yeah, so, nursing, one of the most amazing things about nursing is there are just so many opportunities for the nurses across Catholic Health. We have nurses in the hospitals, obviously in acute care. We have nurses in long-term care. We have nurses in hospice and home care and ambulatory care. So there's an opportunity for any nurse to work in many, many varieties of nursing.
Boy, Good Sam is close to my house, and for many years, all my children were born there, and it was many a nurse there who held my hand during difficult times, and you wish you knew all their names because the nurses there made such an impact for me, and I'm sure so many other people.
The thing about nursing is what nurses bring to healthcare is really not only their clinical skill, but their kindness, their compassion, their empathy. We treat patients and we see patients at their most vulnerable, whether you're having a baby as a happiest time, or you're having open heart surgery, or you've been in in an accident where there's a trauma. We're there. Nurses are there. We are with our patients. We are treating them. We are at the bedside where we really want to be. And that's what makes nursing so special. We are able to do so much more than we used to do years ago. When I was a bedside nurse, we weren't really part of the team. We were more about following orders and, carrying out certain treatments and things. But today, nurses are well educated. Nurses are really very, very much an integral part of the healthcare team, and providing the care that I think we've shown actually during COVID. As everybody knows, I think COVID really showed the world what nurses are really about. And kindness and compassion is just one part of that, but it's our skill, it's our profession that we're really moving forward.
Kindness, compassion, and we just saw some of the nurses holding, leaders encourage. And you were just talking about COVID, and that takes all of that. They always had that, but this to a whole new level of how nurses were helping families get through such difficult times. At times they were the only people that were there to communicate with families, or there when someone was at the last few minutes of their lives.
That's right. And it took every ounce of courage for us, because don't forget, we as nurses were concerned about getting COVID ourselves. So you really take, when you think about what that nurse had to do, that nurse went and took care of that patient when nobody else could, and then had to be concerned for him or herself. Mm-hmm. So, but we knew that we were doing the right thing, and we knew that we had to do. We knew we had to do what we had to do, and I'm so incredibly proud of nurses, really across the country, across the world, who showed what we are able to do, the heroes that we are, and the care we provide to patients every single day.
You said it.
So proud of it. I've wanted to be a nurse since I'm, 10 years old. And I love nursing every day that I come to work. I'm proud to be a nurse. And I'm so proud of the nurses at Catholic Health.
Yeah.
They're amazing. They're an amazing profession.
And actually, at Good Sam, too, you recently received a magnet designation for nursing excellence. What is that?
Yeah, so the magnet designation is through the American College of Nurses. And what it is only 9% of the hospitals across the country are magnet designated. It's a journey that we've taken, and when you accomplish it, what it does is it shows that nurses here at Good Samaritan Hospital are highly educated. Our clinical outcomes are excellent. Our patient experience scores are excellent. And one of the most critical things is that the nurses have a voice at the bedside. So our nurses here at Good Samaritan are part of councils that really sit together and decide what's the best way to take care of our patients.
Wow.
It took us a very long time, but we're very, very proud of it.
That says so much about your team. That's an amazing achievement, and that obviously you will continue to have. What would you tell someone right now who's out there and maybe considering a career in nursing?
So, nursing is, as corny as it might sound, nursing is a call. Excuse me, nursing is a calling. Nursing, I think it's hard work, but it is probably the most rewarding profession. You get to do so many things. There are opportunities to do so many things. We want our nurses to be well educated, and but you're not only providing clinical care to the patient, but you also have an opportunity to really sit with patients, help them heal. We do a lot of education of our patients, and I think it's a wonderful profession. There's lots of opportunities for nursing today. There are lots of areas of nursing. There's so many different things that a nurse can do. As we mentioned before at the outset of this segment, you can be a nurse in the hospital, but you can also be a nurse and go to the home care. You can be a nurse in a freestanding ambulatory clinic. You can work in a burn unit. You can work in the operating room, emergency room. So there's just so many different areas that you can work in. And I think that's one of the best things. One of the things that we're trying to do today for young nurses, new nurses, is show them all those different opportunities so that they see that there are a lot of different places that they can, continue the profession.
Well, as you said, it is a calling, and we appreciate all the men and women who are answering that call. Gara, thank you so much. Again, May 6th, National Recognition Day for Nurses, and we recognize everything you are doing. Go hug a nurse tomorrow. And it's National,
thank you so much.
National Nurses Week, the whole week too, May 6th through May 12th, which is Florence Nightingale's birthday.
That's correct. Thank you.
Thank you, Gara.
Thank you for having me.